Paul is one of hundreds of East Londoners living with HIV. As a director of Positive East, an AIDS education and prevention charity, he has his work cut out for him already, working in a part of London where the disease is unusually common.
HIV can affect anybody, whether you're black or you're white, whether you're gay or straight or old or young. HIV doesn't discriminate.
Nationally, only 1 in 650 people have HIV, but in the borough of Tower Hamlets, it's 5 times the national average. As of April 1st, when the NHS reform takes effect, public health funding duties will be transferred to local councils. Paul fears that services in poorer areas that are highly dependent on the NHS could be negatively impacted.
About 80% of our money comes from bits of the government or bits of the NHS, and we are frightened that money on prevention that the council should spend will get cut because it's seen as an easy thing to cut.
The transfer of public health funding back to local authorities is just one of many reforms in the Health and Social Care Act aimed at decentralising the country's medical services. Nearly £860 million is set to go back to council hands, about £5 million of which belongs to Tower Hamlets. The Terence Higgins Trust sees the new system as a way to better direct services at the local level.
Local authorities are really good at commissioning services that have the needs of their population in mind, and they're very good. They know who their local population is and the challenges they face, and they're really good at commissioning services to address that. So that's very heartening. There's a real opportunity here for things to, for local authorities to take hold of sexual health and really run with it.
But for people like Paul, living with HIV goes far beyond issues of money and where it comes from. McDonald, City News International.